Good afternoon, everyone. Thank you so much for joining our Master of Public Health webinar today. We're so glad that you can join us. We're going to get to our agenda in just a few moments and our introductions. I am joined by Dr. Vicky Hart. Thank you so much for being with us, and Vika Pleshakova, one of our enrollment specialists. Thank you so much for being with us today. So we're going to get into what is epidemiology. So we're going to focus in one area of public health today, and we're going to explore that in more depth. Epidemiologists are called disease detectives, and there's a lot of activity in the news today. So we'll uncover what does that mean and what do epidemiologists do, especially related to some of the coronavirus and some of the news that we're seeing out there today. Career opportunities, not only in epidemiology, but also with a Master of Public Health. And then Vika will walk us through some of the benefits of the program. We'll talk about the logistics of the program and some of those application deadlines, which are fast approaching. As I've mentioned, thank you very much, Emily and Alexis, for answering my question in the chat box. If you do have questions throughout the presentation, please put it in the chat box, and I will do my best to monitor those. So as I mentioned, Dr. Hart is with us today. She is one of our assistant professors, and she focuses in epidemiology. So we'll learn a little bit more about that and biostatistics and how those two cross over as well. And Vika Pleshakova is out of our continuing and distance education. She's a student services professional, and she also works very closely with our Masters in Public Health students. So if you have any questions, it is likely that Vika will be the one answering them for you. And if you hopefully end up in our program, you will also be working with Vika as well, as she advises our students in our program. So we want to get into our Master in Public Health has a variety of different areas that you can focus in. And one that we love is epidemiology. And I bet that warms your heart to hear that
it really does.
So let's back up a little bit.
Sure.
What is epidemiology, and why is that a component of public health?
Sure. So epidemiology at its core is the study of the cause and spread of disease. So if you think about the word epidemiology, it's the same root as epidemic. So it's looking at how diseases present in our populations, in our communities, and then how those diseases spread between people and between communities as well.
And I would imagine there's no shortage of work to be done for
Absolutely
epidemiologists.
not.
Seems like that
Yeah,
there's something
not.
new, and those are just things that we hear about. I think there's probably challenges and disease outbreaks that are just smaller scale, medium and large, and is that true?
Yeah, if anybody's interested, the WHO has a great website where they track disease outbreaks, and it's amazing. There's more than 10 each day that are reported to the WHO across the world as far as disease outbreaks. We hear about the big ones, but there's a lot going on. And that's just one piece of epidemiology is reacting to those outbreaks and thinking about how they're spreading through the populations. A whole other piece of epidemiology is proactively looking at risk factors for disease and what can we do to prevent these before they even start.
Why epidemiology? Why, out of all the different things that you could do, why was this an area that was of interest for you?
Well, I'll tell you a little bit of history about how I got into public health. I started out as a mechanical engineer, which is kind of a strange beginning for a public health person. And I got really into statistics through mechanical and manufacturing engineering. I was working in aerospace, and I really wanted something to put my skills to practice in an area that would make a difference, that I would feel was really rewarding and meaningful. And that's when I learned about biostatistics, which also led me to epidemiology, to be able to use quantitative skills, math skills, problem-solving skills in an area that I feel is really making a difference in the health of the population.
One of the things that I think we had up on your slide earlier is looking at public health study design.
Yes.
And so I think it's really interesting the things that we see in the news of disease spread, and that I think we associate with epidemiology and epidemiologists. But there's a lot of other uses for this kind of skill that maybe isn't as newsworthy.
All newsworthy.
It is, of
it's
course,
all newsworthy.
Right. Depends on who you ask.
But yeah, it's not quite such a violent outbreak kind of thing. Epidemiologic study design is really the core of epidemiologic methods. So it's looking at what is the disease in this population versus what is the disease in this population, and do we really see significant differences so we can say either this risk factor is associated with disease or this population is seeing more disease and what do we want to do about it. And we use those epi study designs in order to make really good comparisons, to know that the differences that we're seeing are because of whatever we're studying and not because of some other difference in the population.
Interesting. Is this an area that you get people asking a lot about as prospective students coming into our MPH program?
Yes, epidemiology seems to be one of the most popular fields within the Masters in Public Health, as well as environmental and global public health. That's
Yeah.
an emerging field of interest for the students.
And if there's folks who are on with us today that are interested in epi, we'd love to hear that. Hopefully that's why you're joining us today as well. So let's get into, we talked about proactive, we talked about reactive, we talked about creating studies and assessing different populations. I love this term that epidemiologists are disease
They
detectives.
really are.
Yeah, and so
Yeah.
walk us through a little bit, and what are we seeing here on that slide?
Sure.
Walk us through what that means.
So on that slide, so the first recorded instance of epidemiology was a cholera outbreak in London, way back before public health really was a topic or really was an area of study. And the first epidemiologist, John Snow, went around and created this map, which is what you see on the slide here. And in the center is a water pump, which was actually the source of that epidemic. And they didn't know it at the time, but it was his, they call it foot leather epidemiology. It was him walking around the streets of London, going to each house, recording who had the disease, where they were getting their water, where they were getting their food, all the different things that could be part of this disease outbreak. And then finally narrowing it down by marking everything on a map and going through this whole detective process to narrow down that it must be this water pump that was causing the problem. And then he was able to go to the authorities and lobby them to shut down that pump, and it stopped the spread of that cholera outbreak in London. So it's really cool, and that pump still exists in London. It's bronzed, and you can go visit it if you ever happen to be there.
Part of epidemiology history,
exactly,
I would imagine.
Exactly.
And so how do you translate that to, I would imagine that people are, watching the coronavirus, and that's obviously just one that's making a lot of headlines right now because many people are sick and dying, and it seems to be spreading. How would a disease detective approach something like that? Very similar to what you were describing, but much larger scale. And thinking about how diseases can travel today, very different than just walking around London trying to find the source.
Yes. So there's pros and cons of being an epidemiologist today. So pros are that we have much better data transfer, so we can find out what's going on in different places in the world very quickly. So when we have an outbreak of coronavirus in the U.S. or in Europe or somewhere other than the identified source, we know about it really quickly. The downside is it can get there.
Yeah.
So with global travel, it's really easy for disease to spread in a way that it wasn't in John Snow's London. So it can present a lot of challenges. But when coronavirus was identified as an outbreak, it happens as it usually does, that certain hospitals start reporting cases of certain diseases. They start to see similarities enough that people know to go to a Department of Health and say, something's going on here. Can we employ some epidemiologists to look at this outbreak? And then it's surprisingly similar to the cholera outbreak. It's figuring out, where are these outbreaks taking place? What have these people been doing? Where have they been traveling? And really doing that detective work to figure out, how do we get back to the source of this disease? And then once we think we've identified a source, whether or not it's clinically, proven yet, we can even go ahead and take steps to start preventing the outbreak of that. And some of our viewers may have heard about the quarantines that took place in Wuhan, China. They shut down the airports, they shut down the train stations and the highways very quickly in order to say, okay, we've identified that this is the epicenter, that word again, epicenter of this disease, and what can we do to contain this in the near term while we're figuring out where this disease is going and what the potential risk factors are.
And at that point, too, epidemiologists probably intersect with so many other practitioners and researchers. And so it's really interesting to think about that the center, and also just thinking about how they can support so many different other practitioners to try to understand what is happening.
Right. One of the things that I love about EPI is you get to touch every piece of public health. So we're working with biostatisticians to say, especially in the research side, are there significant differences between this group and this group? But in an outbreak investigation, we're working with policy people to understand, when do we shut the pump down? When do we close the highways? With lawmakers, all kinds of folks who are interested in that. We're working with the public to figure out what their experience is and their risk factors, and what we can do to help the public prevent disease or stop an outbreak of disease. So we're really working across the board with all kinds of public health professionals to understand what's going on. And now it is a global world, so we tend to be working across borders as well,
Wow.
which is really cool.
Fascinating work, and I think it is a aptly titled Disease Detectives because it really is quite investigative and really systematic, I would imagine, in the approach too.
Yeah.
And so we've touched a little bit on some of the different things because you've just been talking about creating public health studies and medical research methodology and dealing with infectious disease and in-depth academic research. And so is there anything else that you wanted to touch on here or maybe mention if we hadn't yet?
I guess I want to talk a little bit more on the research side
Yeah,
because
please.
people see the movie
Yeah.
Contagion. They see that's the sexy side of
Right.
epidemiology. And the piece that's less talked about is the preventive side.
Yeah.
We do a lot of work in academic institutions, but also in departments of public health and across the board, looking at what may be risk factors to prevent disease. Because ideally, we'd love to get to the point where we're not seeing outbreaks.
Right.
And so that's a really key part of epidemiology. And one thing that I really love about it is, as population scientists, we get to inform clinical science. So there's some great examples where we saw something in a population, we don't know why it's happening, but it's able to inform clinical science. And a great example of that is the Women's Health Initiative. So that was a study that was started to look at hormone replacement therapy in menopausal women and the effect on cardiovascular disease, on heart disease. And there was some great evidence that hormone therapy would reduce cardiovascular disease. But what they found during the trial, they had no idea why, but the women on hormone therapy had higher incidence of breast cancer. And they actually stopped the trial prematurely because of this. But they were able to then go to researchers and say, hey, we don't know why this is happening, but consistently in the population, we're seeing this association. And that led to a lot of research on estrogen therapy and a lot of what we know now and different formulations of estrogens that are not risk factors for breast cancer. So cool stuff going on.
Yeah, it is cool stuff.
Yeah.
That's wonderful. Thank you so much, Dr. Hart, for sharing some of that information with us. And if this sounds interesting to you, we can share this and happy to share this. Maybe Kelly could put the link into our chat box as well. This is a really fun kind of mini module, like a little bit of look in behind the scenes as to our course. Dr. Hart has put together an online introduction to epidemiology. There's some quizzes. There's some things that you need to kind of get through to pass. But it's really fun.
Hard.
No,
Yeah.
and I passed, so I think you could make it. And it gives you an indication of what it would be like to learn more about this and the teaching style and what it's like to take an online course. So we highly recommend checking that out. And
Can I just say,
please, of course.
Some of the students who come into the epi and biostats classes are concerned because they are fairly quantitative. It's it's not something that everybody has been doing in their daily lives since they left school, and so that's a great way to jump in and say it's not going to be so bad. We'll help you learn what you need to know, and that gives you an example of how we teach epi in the program.
And it's a great example of courses and a degree program online. And so it'll give you an idea of how interactive it is, what the learning environment is like, and the resources that you have available. So if you haven't taken an online course and this is something that you're interested in, I would definitely recommend that you check out that link to the little mini module of epidemiology. So let's move over a little bit broader. Let's go up a little bit and look at what is our program and our Master of Public Health program. And so it's, as we've mentioned, it's online, it's interdisciplinary. And maybe we could talk a little bit, Vika, could you walk us through some of the credits and the requirements and things like that we're seeing that is required to complete this program?
Of course. So first of all, you would have two options. If you're interested in epidemiology specifically, you can complete a graduate certificate in epidemiology where you would take 6 courses. But those 6 courses can be also part of your MPH. And that one you will have to take 42 credits, which includes Epidemiology 1, Epidemiology 2, and Biostatistics as your quantitative courses. And we also have Biostatistics 2 for those people who are interested, which is a part of Epidemiology certificate. You also have a culminating project experience where you will be working on a set of data with a group of students and present on your findings, as well as getting a chance to apply the knowledge that you've gained throughout MPH in the real work experience for at least 20 hours as you complete the program.
Yeah, and I wanted to also touch on the fact that you've just mentioned a variety of different things that you could be doing, and they
Mm-hmm.
all intersect as what Dr. Carney, who leads the program, calls those areas of excellence, kind of
Mm-hmm.
the intersection of all of these different components of to create a generalist Master of Public Health program. What does that mean? I suspect we get that question a lot. What does it mean to have a generalist Master of Public Health program?
So really, it's giving you the core foundations to go anywhere in public health. So we talk about a generalist program, and you can see on the slide the different areas of excellence that we have. But you have the opportunity, you have a core base that gives you a good general basic public health foundation from which you can then build into any of these areas of excellence or stay generalist because there's a lot of application for that as well.
And that's a great lead in to what are some of the different applications that you could be doing. We've been talking a lot about epidemiology, and so there's a variety of different things here on that slide, and I won't necessarily read them, but I think it's important. We were talking before we started with Vika about some of the different positions that our students have gone into.
Mm-hmm.
Just share with us some of the things we were talking about before, the different positions.
Sure. We've had students who work in the Vermont Department of Health, for example, and for some of them it was either a promotion when they got a different position within the department after they've gotten their MPH, or it was a lateral move. For example, they were doing some web development, and then once they got their MPH, they moved into a different department. We also have health educators working out in the community. We have a tobacco cessation health educator in New York. We have people working for the health insurance companies as well as epidemiologists, and also working within the environmental public health.
So it's really a variety of different things that you can do with
I
it.
wanted to add to that. I write a lot of recommendation letters for PhD programs, for clinical programs, MD and nursing programs as well. So we have a number of our students that use this as a jumping off point for more education as well.
In the health field as well. And so if this is something you're interested in, you may be asking some of these same questions. These are the questions that Vika gets probably most often.
Yes.
And so we wanted to put those together. And if you have additional questions, please do put it in the chat box, or you can follow up with us afterwards. But let's go through these because I know you answer them time and time again. So let's share with our folks listening today, how long does it take to complete?
Sure. So MPH or a certificate, whichever one you choose, it takes 5 years maximum to complete. So you have the 5-year limit, and most of our students are working full time, so they would be taking at least 1 or 2 courses per semester. We would come up with a plan before you start the program to make sure you are taking the courses within the next 2 to 5 years to complete the program, whatever works with your schedule, however well you balance your life, work, and
family.
School, family. Yes. So depending on your situation, we will work out a plan for you.
Tuition and financial aid.
Tuition.
I suspect you get that question a lot too.
The certificate students unfortunately do not qualify for federal loans. And the tuition is $683 per credit for Vermont residents and $970 for out-of-state residents, which is cheaper than for on-campus graduate students. And financial aid is available for the degree students. You have to be taking at least 2 courses per semester to qualify for the loans.
And we'll have that slide up as well that has the tuition breakdown and some of those deadlines too. This is a great question. Rebecca is asking, I see it's recommended to have 1 academic reference. It isn't possible for her circumstance when she graduated. How much of a detriment would that be to the application?
It is not.
Okay.
As long as it's somebody who could be your coworker, mentor, as long as it's not family or a friend who can attest to your work ethics and character, you should be fine.
Great. That's a great question. Thank you for asking
and
that.
we realize that a lot of students have been out of college for a long time, so it's not possible for them to get those academic letters of recommendation.
Right. Those people might not be there anymore.
Correct.
So this might be a little bit challenging. So that's a great question. Thank you for that. We talked a little bit about how online courses work, and so let's dive into that.
Sure.
And I also do want to share that if you're receiving our emails, hence you're here today, we often have a how to be successful online webinar, and we have lots of resources on our website as well at learn.uvm.edu that walks you through some of these trainings and demos of our online platform. So if it's something that you're interested in, you're a little nervous about the online platform, we have lots of tools to be able to help you succeed in that. So, but what is it like to learn in our MPH program?
Yeah, so the way that we structure our courses, we call it an asynchronous online environment. And that means that there's no set class times. So you don't have to show up at any particular time, because we do recognize that our students, a lot of them are working, a lot of them are parents. They're going to have different schedules. So the way that we structure our courses is on a weekly structure, but asynchronous within that week. So for example, in my epidemiology course, the course materials release on Friday nights. So students have from that Saturday to the following Sunday to complete that week's worth of material. So you have to stay on track within that week, which helps to keep everybody, on the same pace. And the material really does build on itself. So it's important to stay up to date. But it does allow some flexibility in when that's completed throughout the course.
And as I mentioned before, we had showed the slide of the mini module. I think it gives a good example of the type of experience that you would have in line two, because there's a lot of video lecture, and so it described what that is like when somebody's logging in. What are they going to expect to be kind of engaging with?
Yeah, it varies class to class, and it varies obviously on the topic of the class. But we really do try to keep the online environment engaging for students. We recognize that you're sitting at your desk. It's not always the most engaging environment. There's a lot of distractions. So we try to keep, sort of visual things going, create a lot of color, and be able to have short lectures, maybe multiple short lectures, so that students can fit them into their schedule nicely. We also think about the types of assessments that work with students, and not everybody responds the same way to a multiple choice quiz versus an essay versus some other kind of assessment. So we really try to vary that so that everybody has an opportunity to shine in the way that is appropriate for them.
And I think it's really important to note too that you're accessible, and our instructors are their whole point is you want to see them succeed. And so obviously you need to put the work in, but the Vika is absolutely there to answer questions and to support students throughout the process.
Yeah, we're teaching the courses. So it's not like you log in online and you're on your own. There's always an instructor who's there for the course, grading as you're going along, giving you feedback, and they're accessible for questions as well.
Awesome, great. Maybe we'll just touch on these last two because I think these are important too. We've touched on them a little bit, but people often ask, can I have a concentration in my MPH program?
Yes. As you had mentioned, we are a generalist program, but you could cater the courses that you take towards the specific field that you're interested in. For example, you will be required to take 3 elective courses, and if you're interested in epidemiology, you can take an upper level biostatistics course or investigating disease outbreaks, for example, besides the core courses that you have to take, epidemiology and biostatistics.
And internships. People are always looking for, how do I get some experience?
Internships, yes. We do have a career coach, Heather, that we refer students to because she has an extensive network of MPH alumni, and we work with Vermont's Department of Public Health, and she may also be available to connect you to the resources within your state or your community.
That raises a good point too, because our students are all over the United States and some outside of the United States as well.
Correct.
And so this is a unique aspect of UVM's Master Public Health program is our career coaching. And one of the things that's really fantastic is that Heather works with our students right from the beginning and alumni. And so I've had many alumni that I've spoken to say, oh my goodness, I didn't know I could continue to grow in my career and have the support of our career coach and Heather Palo. So you can see a little bit of the information on the slide there, the types of support that she provides to students, but this is an added benefit to UVM's MPH program. Vika has touched on a couple of things today in terms of a letter of recommendation. So walk us through some of the things that somebody might want to start to collect and think about that would be required to apply.
Sure. Our application is fairly simple as far as the graduate application goes. You submit an online application, 3 letters of recommendation, $60 fee, and unofficial transcripts that we can review your application with. You don't have to send official ones right away. We can speed up the process by looking at your unofficial transcripts, but eventually you will have to submit the official ones. We do not require any standardized testing at this point. We only ask that you have a graduate, an undergraduate, or a college level course in math and science. We're looking for basic understanding of science and math because you will be taking highly quantitative courses like epidemiology and biostatistics, so we want to make sure that you'll be successful in those courses.
And a personal statement, I think that's an important thing too, because that's really their way to communicate why at this point in their lives and what they're interested in. And then you've talked about the application fee, and all of this is online. Again, on our website, all of this information is there. If you have any questions related to the application process, we would absolutely love to help you through that. Vika had mentioned some of the tuition dollar figures here on this slide. There is financial aid available to MPH students, so if there is a need and a question, please get in touch with us. We do have some application deadlines that are coming up, not too quickly, but if you're trying to collect all this information, you want to keep an eye on that April 1st deadline if you're interested in starting in the summer. If you want a little bit more time to plan to start in the fall, that is August 1st is that deadline. Is there a maximum number of people? Or do we have a limit that we would accept in? Are the seats kind of hot that we need to?
We will accommodate the students. Yes, Vicky knows that.
Yeah. Just wondering
large number of students in the biostatistics class. Yes.
Yeah. Well, it's great to see that the program. The program is definitely growing, which is a lot of fun, and it's a lot of fun for us as instructors to work through that.
Absolutely. Just thinking if people are interested, and this is something that you would recommend getting an application in, you could defer if you are getting your application in sooner, but fall is your plan. That would be wise to do as well.
Yes.
Okay. Great.
And the beauty of this program is that you can start any time of the year. You can do summer, fall, or spring, and you do not have a specific set of courses that you have to take in the sequence. As long as you take specific courses that do not have prerequisites, we can definitely fit you in at any point.
And that's, you work with students on building that plan.
Correct. Yeah. And I would be happy to meet with you before you even start the program, or if you have any questions about application, I'll be happy to answer them.
Thank you, Vika. So helpful. One of the things that we're really excited about as well is the Master Public Health team.
Absolutely.
So that isn't just Vicki, and we mentioned Dr. Jan Carney as well. Maybe give us a little bit of description of some of the skill sets and backgrounds of some of the people that are on your team as well.
Sure. So we have core faculty. Dr. Carney's one. She's an ex-commissioner of health in Vermont, so she's got a great background in policy, and that sort of is the overarching framework of our program comes from Jan. I work on the quantitative side, an Epi and Biostats program, public health program evaluation, health data communication, survey design, those types of things. And Dr. Kelsey Gleason is an expert. She's an environmental epidemiologist. She's done a lot of work throughout the world, Micronesia and other places, in global health. And then we also have Dr. Tom Delaney, who's a core faculty member, who has experience in qualitative data, but he also works very closely in mental health and suicide prevention in Vermont and beyond. So that's our real core faculty. And then we employ a number of other faculty who do help with our electives in areas like zoonosis, law and ethics in health policy, communication, infectious disease outbreaks, as you talked about. So we really have a very broad range of interests and disciplines within public health, in addition to our core faculty members.
Great, thank you. And you can learn more about those folks as well on our website. So we want to hear from Dr. Gleason. She is doing a webinar coming up on June 17th, focusing on global health. So we're going to play a quick video. We'll pause for a sec. We'll be back after the video. We're going to hear more about what she's presenting in June.
Hey everyone. Environmental epidemiologist by training, but my research focuses primarily on global health issues around the world. My work is an example of one of the best parts of an MPH, the ability to use your interdisciplinary training and skills that you received during your MPH education in a wide variety of ways. On the next public health webinar, I'm going to give an introduction into global health by talking about public health in humanitarian crises, disaster risk reduction, and how global health issues around the world are being impacted by climate change. I hope you will all tune in to see some of the ways that you can apply the different skills and public health concepts that you learn, like epidemiology, in global health. I'll see you next time.
Hopefully that gives you a glimpse as to what else we're going to talk about as we continue to dive deeper into these different areas in public health. And we will have that link up pretty soon for that webinar, and we'll share it back with everybody joining us today. We've had, a few questions in the chat box today. If there's anybody else that has anything that you would like to know about the admissions process, about epidemiology specifically, generalist program, we'd be happy to share that. As we have had in our chat box as well, Kelly has been putting up some links. Kelly, could you just pop in our email address? Oh, she already did. So she's already ahead of me on that one. The learn@uvm.edu. And you can certainly, in the subject line, indicate that you just participated in the MPH webinar and you have a question for Vika, something specific. We would be happy to see those and answer those. So maybe I'll just, I know it's always putting you guys on the spot, tossing back, but you advise and work with a variety of different students. What do you really enjoy about working with our MPH students?
I am really amazed at how driven and hardworking they are. It's not easy to balance your adult life and family and full-time job and taking online graduate level courses towards really improving your career or professional development.
And so, and you help them every step of the way. You
Every
really
step
do.
of the way, yes. And it's always new, it's always interesting. I meet all kinds of people, and that's the best part of my job.
Awesome.
I really love the diversity of our students, and that's one of the things I appreciate most about an online program. I have students in my classes who are MDs, so they've been practicing medicine for years, and they're now coming back with an interest in public health. And then I have students who are right out of their undergraduate programs and knew that they were interested in public health, and they get to work together and really learn from each other's experience. And I think that's a great melding of opportunity and perspectives in these online classes.
And you make a great point too, is they're working together. You
Really
think
are,
about
yeah.
online course that am I going to be doing this on my own? And while they're absolutely, it is on you to be able to show up and do the work and complete the assignments, but you are absolutely having many opportunities to engage with each other.
Yes, most classes include some kind of discussion component, and we're working on the best tools available to promote good discussion and engaging discussion with our students. And a lot of classes, not even to mention the capstone project, a lot of individual classes have group projects as well, where students have the opportunity to interact and work with each other. And we help with free tools to video conference, teleconference, that kind of thing, so people can connect.
We do have a question here as well. For quantitative courses, is calculus a necessary requirement? I jump back over to the slide in terms of the requirements. Can you answer that question for us? Is calculus?
Calculus is absolutely not a
Not
requirement,
required.
no.
Okay.
A basic college level math
Right.
course and science course lets us know that you have some quantitative understanding, some background, but we'll teach you what you need to know with biostatistics and epi. We start at the basics and we work up from there with it in the context of public health. So we're not trying to teach theoretical math through this program. We're trying to teach you what you need to be a public health professional.
Great. Thank you very much. And that was a great question. If there's any other questions, we're happy to answer them. And as I mentioned before, email address is up as well. We have a specific public health email. You can always email us at learn@uvm.edu. So I think we're probably going to sign off. I'm seeing a slowdown in the questions today. We will send out this recorded webinar so that you can watch that again and share it and consider if this is a program that's right for you. And as we mentioned, the deadline for our summer start is coming up on April 1st, and then fall will be in August. And the application is online, so if you have any questions related to that, please do get in touch with us. I am seeing some typing. Let's just pause for a second to see if that question might come through before we sign off. I know it always takes a little bit to see as I'm seeing you type. How long do people typically take in completing? You have up to 5, but is it usually 2 years?
Typically it's 2 to 3 years. Yeah.
That's what I thought, in trying to fit in with family and school and work. And you said folks usually take 2 courses a semester.
2 courses per semester.
Yeah, and that kind of gets you on track to almost finish in 2,
Yes.
2 to 3. Yeah. So are there times then, you could certainly say in the summer I'm traveling a lot or doing various different things, that 1 course in the summer is what I can do, and you work with them to outline that.
Yes. We can come up with the plan that will suit the students' needs. We can eliminate summer courses if they need to and see how long that will take, and then it lets the students decide what they would like to do.
Great.
But most of them would like to move along.
Keep it going.
quickly,
We keep it going, right?
Yes.
Once you're
It's the
in,
momentum, and
eye on the prize, right? We do have a question as well. Oh, good. We have 2 more questions. I'm glad we waited. Is there a minimum GPA requirement?
We typically ask for 3.0 as a minimum GPA, but we look at your application holistically, and we understand that for some people, an undergraduate GPA may not be reflective of their capabilities and their abilities and skills. So we would look at your letters of recommendation and your personal statement. We also admit students conditionally. For example, if you are missing a math or statistics course, we would say we would admit you if you get a B minus or above in epidemiology or biostatistics, for example. So it is possible, and we're fairly open to letting all the students in.
Another good question too. Do we anticipate the CEPH certification in 2021?
We do indeed.
Ah,
Yes.
look at that.
So
You're
we're-
hearing it here first. I love the look
No,
between the two
yes.
of you, like, oh.
We've been working really hard for the past several years towards
great.
CEPH accreditation,
Yep.
and we're doing it as fast as we can.
Yep.
You have to be a program for a certain amount of time before you can even apply. We applied as soon as we could,
Yep.
and we're going through the processes as quickly as possible. We've had a preliminary visit. We have another visit coming up this fall that we're all working really hard towards, and all going well. We're on track for that.
Sounds great. Yeah, that's something we should continue to talk about in these webinars as well, because that's
Absolutely.
wonderful. Thank
Yeah.
you for asking that question.
It's a great
We
question.
really appreciate that. So it looks like we're in good shape here with our questions. We really appreciate your time today. We'll let you get back to your busy days, and we hope to see you in our Master of Public Health program. Have a great afternoon.